I get the pleasure this morning to introduce the boys from Boca. And so the teenage years, I think, are hard enough. And as a teacher of teenagers, I definitely got to see my fair share of that and went through my own awkward years myself. But when you have to face partial anodontia, they can be even worse. And the team we have up here with us today are hailing from, as you could tell, Boca Raton, Florida, and they're highly skilled clinicians and technicians that tackle just such a case. This team includes orthodontist Dr. John Marchetto, prosthodontist Dr. Tal Morr, lab technician Dr. Emanuela Piazzera, and oral surgeon Dr. Stephen Reimer. Please help me welcome them to the main stage.
Thank you. Good morning, and thank you very much. It's really a special treat. Thanks to Michael for inviting us. When he asked me some time ago what we'd like to do, and I said the whole basis for the Seattle Study Club for me is interdisciplinary treatment planning. So therefore, could I do it with my friends so that you could see not my idea or Tal's idea or John's idea or what was involved, and most importantly, we believe the lab technician is an equal partner. So to have Emanuele with us was very, very important. So given that, we decided to treat a case or to show you a case. This is not a lecture. We're going to get some participation. We may even get the lights up a little bit. We'll see how we go. But really a real challenge, because we've been involved with this patient for over 8.5 years, almost 9 years. She still has not completed treatment, and you'll understand why. And we're going to go through different phases of the therapy, but the most important part is, part of this team is the patient and the patient's family, because this is a huge psychological problem in treating these kinds of patients. Tal and I specifically have been involved in quite a number of these kinds of cases, and the patient is a part of dictating how we have done the treatment plan and how we proceeded. So without further ado, let Tal start and introduce our patient.
Thank you very much, Steve. And I know I give you a lot of crap, but it's only from love. And I have to tell you that our relationship, I've learned a tremendous amount from all these guys, and I think that we grew together, and that's why we work so well together, even though, again, we give each other some crap. So anyway, let's look at the patient. We won't really name, well, we'll name her Carrie. It's not her real name, and notice that we blackened out her eyes because she requested that we don't show that, so I apologize. But let me introduce to you Carrie, and at the age of 10 years old, she presented to Dr. John Marchetto's office. That was in March of 2004, and at that time, her chief complaint was, I'm missing a lot of teeth, and kids are starting to make fun of me. So that's basically her main rationale for presenting. And you notice that she's wearing a retainer on top. And that retainer was given to her in 2004 for the purpose of trying to hide the fact that she's missing a lot of teeth. Okay, so it's purely an aesthetic thing, you know? The other kids had braces, so she figured why not wear a retainer to try to hide what's going on underneath. She presented to my office in October of 2005, at which time she was 11 years old. And this is how she presented. And if we look at her facial features, I want you to notice that she has a concave profile. You'll notice that she has a slight AP deficiency of the maxilla, so a maxillary deficiency, and therefore she has inadequate lip support. You'll notice that she has a poor nasolabial angle. And if you look from a facial perspective, you notice the asymmetric symphysis. So it's over to the right-hand side of her face, which means the left side of her face is longer than the right. And she has a very narrow maxilla with large negative spaces due to a transverse discrepancy on the maxilla relative to the mandible. If we look a little bit closer, you notice from these photos that she has a diastema between teeth numbers 8 and 9. There's crowding of the anterior deciduous laterals, which are now overlapping the central incisors. The upper canine is erupting in